So hi everyone, welcome back to Little Growing Bombs. Today we'll discuss a condition that's more common than you might think, and it's called avascular necrosis of the femoral head, or AVN for short. So it's a condition that affects the hip joint and can have a big impact on mobility and the quality of life of the patients who actually get these conditions. So I'll cover the causes, the symptoms, how we diagnose it, how we treat, and the potential complications from this condition. So let's jump right into it. So what is avascular necrosis, or what is AVN? So I do have some so-born models that I can use to describe what a hip joint is and what avascular necrosis is, all right? So I do have a so-born model of a femur. The femur is the bone in the thigh, and this is what makes up the hip joint, at least the ball part of the socket. I do have a so-born model of the pelvis, and this is the socket, this over here. So this ball is supposed to articulate in there in the socket, all right? So back to the femur, this ball part of the femur, or the head of the femur, is able to receive blood through blood vessels that permeate and pass and get to the head, all right? When someone gets avascular necrosis or AVN, blood supply has been cut off from the ball part, all right? So it is not getting blood. The blood supply has been disrupted. And without enough blood supply, the bone tissues begin to die, which can lead to the collapse of the femoral head. So it loses its roundness and slowly crumbles. And this is why sometimes AVN is called bone death. But it can happen in many other joints. The hip joint is what is most commonly affected, and it's what we'll be talking about today. So what are the causes and risk factors of vascular necrosis? One is trauma. So an injury to the hip joint, for example, like a fracture of the neck of the femur, fracture of the head, a dislocation, all can disrupt blood flow to the femoral head and ultimately leading to AVN. Excessive alcohol use, this can lead to fatty deposits in the blood vessels, reducing the blood supply to the femoral head and ultimately AVN. Use of steroids, so high dose steroids for a prolonged period of time, can be a significant risk factor for AVN. There's some medical conditions like sickle cell anemia, lupus, and other conditions with blood clotting issues can predispose to avascular necrosis. Sometimes we don't know what's causing it, and so there's something like idiopathic causes. These can also predispose to avascular necrosis. In children can also follow other conditions like Perthes disease, and this is also another cause of avascular necrosis in children. Another risk factor or cause of vascular necrosis is infection of the joint or the bone. So when the infection comes and causes marked destruction around this bone, it can affect the blood supply to the head and ultimately lead to vascular necrosis. So what are the symptoms to watch for? So some of the top warning signs are things like one, hip pain. So this usually starts as a mild discomfort, but can progressively become very severe over time. It's often felt in the groin, the thigh, the buttock, and sometimes even in the knee. All right. Another is stiffness and reduced mobility. So moving the hip joint can become difficult over time. Sometimes there's pain during weight-bearing activities like walking, climbing stairs, standing for long hours. All can make the pain very severe, and this can really affect how much activity the children get to have. Another symptom is limping. So this tends to occur as the condition worsens and the bone starts to collapse. The symptoms often develop gradually, making early detection challenging, but it is critical if it's picked up early. Right? So one of the most common investigations done is the X-ray. So this can show changes in the bone structure, especially in the late stages. Another test that is done is the MRI scan. So this is the gold standard for early detection, as it can help identify AVN before any structural changes even happen on the X-ray. CT scans can also be done, and they are useful, and they do help in the assessment of the extent of the bone damage if it has happened. Another test that is done but not so often is the bone scans. Can also help detect AVN early. So if your child is experiencing persistent hip pain, don't ignore it. Early diagnosis can be very helpful and can make such a big difference in the outcomes. So like we mentioned earlier, the symptoms aren't only in the hip. Sometimes they're in the thigh, sometimes in the buttock, sometimes they're felt in the knee. So it's important for the doctor to like rule out and see where the problem really is, but very often it's in the hip. So how do we treat avascular necrosis? So treatment of AVN depends on the stage at which the condition is at. So here are some of the treatment options. One is conservative management. So for early stage AVN, this might include things like medication to manage the pain and reduce the inflammation, and also physiotherapy to try and improve the range of motion of the affected joint. So when the physiotherapy is done, the goals are around improving the strength of the affected limb and maintaining or improving the range of motion of that affected hip. When talking about conservative management, you also talk about activity modification. So like we know that sometimes they do get pain when they do any activities that are contact or that require jumping or running. We advise in the modifications activities to perhaps do things that are less likely to cause further collapse of the head. All right. Another is to advise them to reduce weight-bearing activities to help reduce or limit the stress that is put on the hip joint as it's when it has this condition. So that is the non-operative treatment. How about the surgical treatment? Is core decompression surgery. So this procedure involves removing a small portion of the bone to relieve the pressure that has accumulated inside the bone. All right. See, this can involve just drilling into the bone. So this can involve just creating tracks, like drilling some tracks along the bone to try and improve the revascularization of the bone that is affected, and also help reduce the pressure. Sometimes a piece of bone is placed in there, and that's called a bone graft. So it's typically healthy bone that is like transplanted to that area to support the femoral head and improve the recovery process. The very advanced cases and in older children or older individuals, another option is hip replacement surgery. So this is reserved in children who are done growing or in older individuals. So in advanced cases where the femoral head has collapsed fully, total hip replacement may be necessary. And the goal, as always, is to preserve the joint motion as much as possible and improve the quality of life of the individual. So before we end up, let's talk about the potential complications of avascular necrosis. So here are some of the top ones. One is joint collapse. So this may lead to severe arthritis of the hip joint. Another is chronic pain and instability. The pain can become constant and debilitating. All right. Another is reduced quality of life. So this stems from things like how much the AVN could affect mobility of the individuals, affect their day-to-day activities, and affect their independence. And it's based on that we need to diagnose these kinds of conditions very early and treat them adequately to try and improve the outcome and preserve the hip function for as long as possible. So I'd want to give us some take-home messages before we go. While not all cases of AVN can be prevented, there are some steps that we can use to lower the risk of getting avascular necrosis of the femoral head, particularly for parents. So one is use steroids only as prescribed by the doctor. Avoid long-term high dose if possible, except in conditions where it's important to use steroids for the long term, where it's really necessary. Also, treat underlying medical conditions like blood disorders promptly. Thirdly, protect the child's hip if you can protect them from trauma. And I know things can't always be prevented, but if possible, always institute safety measures when going about any risky activities to protect the child from getting these kinds of injuries like hip fractures and the lot. And even though this doesn't really apply to children, it's worthwhile to mention that limitation of alcohol consumption is also important in prevention of avascular necrosis, maybe for the adolescents. So AVN of the femoral head is serious, but with the early diagnosis and the right treatment, many people can regain the mobility and reduce the pain that is associated with that condition. So thank you for watching today, and if you like this video, don't forget to share, subscribe, and give us a thumbs up. And until next time, keep it on little growing bones.